Welcome to This Week in Morgan County. I'm your host, Russell Mokhiber. Our guest this week is Dr. Matthew Hahn. He's the author of a new book, Staying Alive, The Signs That You Have to See a Doctor Right Now and the Ways to Avoid Having to See One Again. Dr. Hahn, welcome to the show.
Thank you, Russell.
I thought staying alive was all about being lucky.
It's very good to be lucky, but in addition to luck, you can actually influence staying alive. And that's what I do. As a family physician, I keep people alive. And I've put my prescription in the book aside from luck.
Now, if you were to, say, summarize this book in 5 points, what are the 5 ways to stay alive?
I would say there are 3 ways.
3, okay.
Number 1, get to the doctor when you have signs of illness. Number 2, take advantage of the miracles of modern preventive medicine. And number 3, most important by far, exercise and eat healthy. The problem is that those 3 things often don't happen, and really I spend a lot of my time trying to make those things happen.
You practice here locally. You have a successful family practice locally here in the Berkeley Springs area in Hancock, Maryland. And you have literally hundreds of patients. Thousands of patients. What, on point number 3, eat well and exercise, what proportion of your patients eat well and exercise?
Too small of a proportion. You know, it mirrors the statistics in this country, that 2/3 of adults in this country are overweight, 1/3 of them are obese, and actually we have some of the worst health statistics in the state of West Virginia here in Morgan County, and where my practice is, Washington County, Maryland, we have some of the worst health statistics in the state of Maryland. So I have my work cut out for me.
Right. And now, why is it? Now, I remember when we first met, you actually tried to implement a program to get your patients to eat well and to exercise, and you have a workbook at the back of this book, which is really very helpful in trying to encourage people to exercise and eat better. But why is that so difficult? Why is it to implement that?
Well, first of all, yeah, in the community here, we did a program for many years called the Health Olympics. And in the Health Olympics, we asked people to make a couple of lifestyle choices. A food they would avoid, and exercise regimen that they would stick to. We gave them calendars to track their course over 2 or 3 months. We gave them gifts. We had educational seminars. We did walks. And what I learned in the 10 or so years that I did that program was that it's really hard to get people to take better care of themselves. People just have so many factors working against them in modern lifestyles.
But despite that, you actually, for the most part, keep your patient population alive.
Absolutely.
And in effect, this book it's your practice in book form.
Yes. But you still have to come see me. You can't just buy the book.
Right, but this is for a national. This is if people can't come see you. Let's say they're living in Colorado or Maine.
Fair enough.
They buy this book, and each chapter is actually a section of the human body where if something goes wrong, it tells you what you might want to do and whether you should take it seriously or not. And so why don't you give us some examples from your own practice about how this works, how if you notice something and you can save your life by using this book.
Yeah, so you're referring to the first part of the book, 62 medical complaints that should never be ignored. And what I have found over the years is that, unfortunately, too many patients come to me with really classic signs of illness or disease, and they've waited too long because they didn't recognize the importance of the symptom. And unfortunately, tragedy can ensue. So what I did was I wrote down from head to toe all of those symptoms so that people would understand when they develop those symptoms what the implications are and how quickly they need to get to the doctor. So for instance, a classic symptom that someone might come to me for would be a one-sided headache with tenderness in the temple. So a person over 50 that has those symptoms, that is classic for a very dangerous diagnosis, an illness called giant cell arteritis. If you get to it in time, if it's treated in time, you prevent blindness. If you don't, you can be permanently blinded. Similarly, there's a diagnosis that most people are not familiar with, cauda-equina syndrome. So cauda-equina syndrome is back pain that quickly turns into numbness, usually in both legs, and weakness, and then numbness in the buttocks or the genitals. And this is an absolute emergency. If you don't get this treated very quickly, 6 to 12 hours, you can have permanent loss of strength. You can have paralysis of the legs that can be permanent.
And one that I had with you was, I looked down on my hand one day and I sort of like a dark vein running up towards my heart.
Yes.
And you spotted it and recognized it as a MRSA infection?
Cellulitis, and was caused by the bacteria MRSA, which can be very dangerous.
Right. So had it made it up to my heart, what would have happened?
Well, I don't like to talk about that. You know, it's.
So those are the kinds of
you
things.
You have life insurance, though.
And these are the kinds of things that are in this book. You have pictures of various kinds of illnesses and so forth, and what people can do about it. A big issue in this area is in the Berkeley Springs, Hancock area, is the what I call the east-west divide. And this is, and you originally were trying to bridge that divide, where you have people who believe in alternative remedies, in homeopathy, who distrust the pharmaceutical industry. But you actually come down pretty strongly now in this book in favor of pharmaceuticals to save lives. Give us your thoughts on that.
Well, I have respect for all approaches to healthcare. But what I have found over the years is that many people are very resistant to any form of allopathic medicine, so mainstream medicine that I prescribe. And
they think drugs are poison.
As a matter of fact, yes, and that's the chapter in the book, the Miracles of Modern Preventive Medicine, starts with that quote. That's an actual quote from a patient. Dr. Hahn, aren't all medicines poison? And so I make the point in that chapter that actually treatments for the most common chronic conditions, dangerous chronic conditions, high blood pressure, high cholesterol, heart disease, and diabetes, are absolutely revolutionary and miraculous. And rather than being frightened of the medications for those problems, we should be happy that we have them. And what I really try to do is change the conversation. So I don't think people should be so frightened of medications. They really should be frightened of those chronic conditions, because cardiovascular disease is the #1 killer in the country. Cancer is #2 killer, and diabetes is the #3 killer. And the treatments that we have for these diseases are often very safe, very old, tried and true, affordable, and usually very easy to take, and extremely effective at preventing, what can occur, like heart attacks and strokes.
You tell a story in the book about this radio show called The People's Pharmacy. And The People's Pharmacy plays early Saturday mornings, and it talks about some of the issues with the pharmaceutical industry and alternatives. Tell us the story that you tell in the book.
Well, so what I try to do in the book is take stories from my practice that are educational, sometimes poignant, sometimes just funny, and I try to make the material more enjoyable to read, just because medical literature can actually be rather dry. But this story, I was driving on a Saturday morning. I was going to go running, and I was listening to this radio program, and the famous Dr. Barry Sears, he's well known for the Zone diet. You don't hear about that one much anymore, but at that time, very popular. And someone called into the program and was telling Dr. Sears that their physician had suggested that they take the popular statin cholesterol medicines because of their high cholesterol. And Dr. Sears essentially said, well, that doctor has no idea what he's talking about, that guy that you go to see. And there was just something that bugged me about the story. But I went on my run and I forgot about it. And a few weeks later, a patient was in the office, and they said to me, Dr. Hahn, are you familiar with a program called the People's Pharmacy? And I said, yes. And then all of a sudden it clicked in my mind. And yes, she said, yes, I called into Dr. Sears. So I said to her, so when Dr. Sears said that your doctor had no idea what he was talking about, he was referring to me? Yes, he was. But I think I know more than Dr. Sears about that topic anyway.
Do you understand people's distrust of the pharmaceutical?
Absolutely. Oh, and I absolutely agree that people should have a healthy distrust of any industry that makes billions of dollars and selling them any goods and services. And I think there are very good examples of pharmaceutical companies making claims that are unbased. No, people should be extremely careful about that, and I understand their concerns. My point is that the treatments for blood pressure, cholesterol, heart disease, and diabetes, at this point in time, most of the medications that I'm prescribing are probably 20 to 25 years old. They can be obtained in generic form. They're relatively inexpensive. And I think the research and the data that supports their use is really, really robust now. And if prescribed properly and monitored properly, I think they're extraordinarily safe and very effective and very helpful. What I've seen in my practice is just in my time as a physician, when I started practicing in the late 90s, I saw the generation of patients who probably did not have their blood pressure and cholesterol monitored for many years. So they were in their 70s and 80s, and they were having horrible problems: heart attacks, stroke, blindness, kidney failure, diabetics losing limbs. And soon after I started practicing, my generation of physicians, I trained in the 90s, we were trained in the chronic care model, and so we monitor all these things and we treat them, and very quickly I saw all of those things begin to disappear. So it's very rare now to see a heart attack or a stroke. I take care of hundreds of people with diabetes. I have no patients who are blind, none who are in kidney failure, none who have lost limbs. And unfortunately, it's not because they take such wonderful care of themselves. It's because used properly, these medications are truly miraculous.
Right, so you have a fundamentally unhealthy population, as is the population of the United States, broadly speaking. But because they have a doctor who's an on-the-grounds doctor, hands-on doc, who keeps an eye on them and then gives them medications when appropriate, you basically are saving lives every day because of that, because of that approach. And this book actually encapsulates your practice. It shows the lessons you've learned in that family practice.
But the best thing really is to combine healthy lifestyle with the medications. What I see as the very best that can happen in healthcare is when people take really good care of themselves, and despite their best efforts, they're still diagnosed with any of these conditions, and then they're treated. It really is miraculous. The real point to get across to people still is that through healthy eating, regular exercise, controlling your weight, not smoking, and avoiding excessive alcohol, you can lower your risk of premature death 80 to 90%. And so when you mix that with proper use of these medications, it really is miraculous. I have people living to 500 and 600 years old. No.
But just a little bit more on the pharmaceutical industry. You've had your run-ins with them, and tell us the stories of the pharma reps who would come by your office and present, boxes of donuts or whatever, and they're pushing new drugs,
yes,
more expensive, newer drugs that haven't been tested as well as the drugs that you prescribe, and they want you to prescribe them instead. How did you deal with that onslaught of pharmaceutical reps who were coming into your office?
Well, I have had some real run-ins over the years. First of all, they don't get to come in my office. I don't accept any gifts. I don't accept any food from them. They would like to come and give me lunch to try to, sell me on their wares, and I don't allow that. And I really, for lots of reasons, I avoid newer medicines in most cases because they're not as well tested. They may become, part of the armamentarium, years to come. But many of them are completely unaffordable for my patients, and therefore I really don't even have the choice of using them. And by and large, I can get away with, really, really good state-of-the-art care without using the newer medications.
What are some, now, before we get to some of the details on kinds of cases that you face, you hear from around the country that it's very difficult to make it as a family doc, as an independent family doc in America. How come you've effectively made it? You have a robust practice, and you're doing well. How are you different from these other docs who are not making and being gobbled up by these big hospital centers and so on?
Well, we're always under threat from that. My practice is a different model where we have figured out the secret to giving patients really good care and do well financially as well. We have, so most physicians are taught that the way to make money, the way to take care of patients is to see as many patients as possible. Just get as many patients in the door and as many patients out as quickly as possible and hire as many staff as you can to make that happen. And what happens is, unfortunately, that means that they have very high overhead in terms of their staffing. And so they're always fighting that overhead. They see 2 or 3 more a day because they hired another person, but then they find that they actually lost money because they hired that extra person. So they see 2 or 3 more patients, and it's just you're a hamster on a wheel. My practice is centered on a model called the ideal medical practice, and I've developed, along with some other physicians, a different take on that model where rather than focusing on volume, what you focus on is giving people really great care with lower overhead. So we use different ideas about how we staff a practice, and we use technology to help us take care of patients with far fewer staff, far less overhead. So it changes the math of a medical practice where I'm not pushed every second to see another patient in the next 2 to 3 minutes. And we actually are able to schedule half-hour appointments for our patients and often spend that amount of time with them. And when you have that time, you can really make amazing things happen. People get time to tell you what's really going on. I have time to get to know my patients and really get to know them as a human being and figure out what's going on with them medically, but also personally, and we can work on things like lifestyle. But also this time of year, flu season, if I do have to push it and see a few more patients, we can do that as well. And it's worked beautifully, and I'm happy to teach other doctors the model because it's really great for patients, and it's really great for me because I don't feel that I'm just rushing people through all the time.
And the other thing that's different is you rarely see doctors, family docs, who will do home visits. And you actually, are you still doing that?
Of course I do home visits.
So when people need to see you in the home, you have a patient population that trends towards elderly.
Sure.
And it's often you will go and visit with your patients.
Yeah, I believe that not everything that a patient needs can actually be done in the office. And one of those things is sometimes, especially with elderly patients, it's much easier for me to go to them than it is for them to come in. And many of my patients live, within 5 minutes of the office. So yeah, we go into the home, and it's good for them. It's actually fun for us to get out of the office now and then, it's just part of our commitment to taking care of patients.
This book will save lives, and it's just out this month. Has it saved any lives yet?
As a matter of fact, it hasn't come out yet. It comes out tomorrow. And one of the people who was editing the book read the section on the bowel and took to heart the advice to get a colonoscopy, had that colonoscopy, which identified a very large precancerous tumor, which was then removed. And so had they waited any longer, that could have been a cancer. So So the book has actually already saved a life despite the fact that it's not out yet. And in a relatively poignant moment a couple of weeks ago, a patient of mine was just leafing through the book, which was sitting on my exam room table, and they saw the description of giant cell arteritis, the one-sided headache, and they said, you know, if I'd had this book a month ago, my sister would be alive today because their sister died from giant cell arteritis.
One thing's one I saw in the pictures here, a picture of a giant rash, the Lyme disease rash.
Absolutely.
And you face that a lot. And it's often, how can this book help on that, on Lyme disease? What do you say about Lyme disease?
Well, we're a Lyme endemic area. We have tons of Lyme disease around here. First and foremost, it's to recognize the signs of Lyme disease. So for instance, or first of all, that rash is extremely characteristic. There's no other rash like it. It's round or oval. It's usually about this big, on average about 6 inches, and often has a bullseye appearance. So first and foremost, recognize that rash and get treated as soon as possible after you see that rash. Second of all, realize a lot of healthcare practitioners, unfortunately, don't understand certain things about Lyme disease. For instance, when you have that rash, you do not need to do any testing to confirm the diagnosis. You treat that rash because often testing for Lyme disease early in the course of disease can be falsely negative. So those are the most important things I see, is recognize that rash and recognize that that rash gets treated with antibiotics. And in my experience, and I have tons of experience taking care of Lyme disease, not one time have I had a patient not get entirely better after receiving antibiotics.
What's the downside on waiting? What happens if you wait?
Well, I mean, there's a lot of controversy about Lyme disease. So there is some thought that if you don't get treated early in the course of the disease, that you might develop chronic symptoms. It's relatively controversial, and my approach is catch it early and treat it. The cases that are actually really difficult, when you see that rash, it's actually fairly simple if you know how to diagnose and treat it. But there are 15 to 20% of Lyme disease cases that don't have the rash. Those are the ones that can be challenging. I actually disagree with the Infectious Disease Society of America, who say that under those circumstances, if you don't have a positive Lyme test, don't treat with antibiotics. I disagree, and I respectfully disagree. I feel that if I think I have a possible Lyme case, I will treat it because I think the risk of missing Lyme disease is greater than the treatment. But you know, it's one of those things. It's an area of real valid disagreement in the science and in medicine.
Chapter 14 is called Lady Parts. What do you mean by that?
I don't want to say on camera.
Well, the thing about these chapters...
It's gynecologic problems. I was just trying to be funny.
I get it. It didn't go off well, but I mean, the point is that you can pick up this book and keep it on your shelf or book stand, and when you come across a problem, check it out. And if it's something that you really need to see a doctor about, it tells you what you have to do.
Yes, I mean, I really intend the first part of the book, 62 Medical Complaints That Should Never Be Ignored, is meant as a reference. I hope people read through it and learn something from it. There are some general hints how to evaluate an illness or symptoms that you're having, but also to keep it as a reference when you do develop signs of illness, even emergency illnesses. And each section, each complaint has what I call a threat level. So it says this is the highest threat level. So for instance, anaphylaxis, a very bad allergic reaction, that has the highest threat level. You have to respond to that sometimes within minutes. And there are other things that low threat level, you could wait a month before seeing a physician. But those things that you need to see now, they're clearly identified in the book, and I tried to make it very easy for people.
Well, the title of the book, again, Staying Alive, the Signs That You Have to See a Doctor Right Now and the Ways to Avoid Having to See One Again, by Dr. Matthew Hahn. Dr. Hahn, thank you for coming on the show. And thank you for watching This Week in Morgan County.